Welcome, everybody. It's so nice to see so many people here on a cold January evening. It's again a great event to host every year. The JD McLean Lecture Series is very special. This is the 20th year that we've held it. And some of you probably aren't aware of just who JD McLean was. JD McLean was a dean of the Faculty of Dentistry. He was the longest serving dean in our faculty, and probably one of the longest serving deans at the university. He served from 1954 to 1975. That sounds impossible. I've been doing this role now for almost 7 years, and I can't imagine it going beyond 10 years. So to have the passionate vision that JD McLean had for 21 years is truly remarkable. It was really under his leadership that the faculty grew into what we see today. There was a lot of building during his tenure, and he also had the foresight and realization as to the importance of dental hygiene. So again, it was under his leadership that the dental hygiene program started at Dal. Dr. McLean firmly believed that all oral healthcare professionals really required a broad education and that we benefit from hearing from people outside of our profession. So started in 2004, the JD McLean Lecture was created to do just that, to broaden our minds and perspectives on a range of topics outside of what we traditionally learn in our oral health curriculum. We are delighted and grateful that Mr. Bob Hope, and we might want to give him a doctor after this evening, but we're delighted that Bob Hope could join us this evening to present the 2024 JD McLean Lecture. I had the pleasure of having dinner with Bob at the President's House on Monday evening and realized very quickly how engaging and passionate he is about the topic he's going to present on. So to introduce Bob, I would ask now that his friend and colleague, Dr. Sharon-Paul Ahluwalia, a 2007 graduate rather, who practices in both Toronto and Nova Scotia, come to the stage to formally introduce tonight's speaker. Charmy?
Good evening, students, faculty, staff, and guests. Welcome to the annual JD McLean Lecture Series. I am Dr. Sharon-Paul Ahluwalia, and the Dental Alumni Committee is pleased to present today's seminar and discussion. We have tried to get everyone motivated to attend the lecture with a social media campaign, posters, and emails from the Dean, as we believe this was a do-not-miss event of the year. We have joining us today for your listening pleasure, the great Bob Hope. And for the Boomer and Gen X generation in the crowd, no, we have not resurrected the greatest comedian and entertainer of his time, but a person just as comical, just as engaging, just as unique as the original. I have known Bob for over 15 years. He has been an instrumental part of my growth and success as a dental professional. He is president of a dental consulting company called Timeshift Solutions and has developed his own dental practice management software called Opus, but he will not be talking shop about dentistry today. He will discuss pressures and obstacles he faced growing up in Winnipeg, Manitoba, his personal and professional failures and successes, his time on Amazing Race Canada, and being in the shadows of his famous significant other. My hope and advice for everyone in the audience today is if you can take away one piece of the lecture and apply it to your personal, professional, or academic life, it will be an hour well spent. Thank you, and without further ado, I would like to introduce to you my colleague, my friend, Mr. Bob Hope.
Okay. Yeah. Well, thank you. And Eldon, can we get the... There we go. All right. Thank you. So thank you, Dr. Davis. It was a pleasure meeting you the other night for the introduction, Dr. Ahluwalia, for Kathy and Cheryl and Bruce for coordinating the details, and of course for all of you for attending tonight. When I was first asked to to come to Dalhousie Faculty of Dentistry to speak to the faculty and the student body, I was like, well, yeah, of course, I'm Bob. I've been in the industry for more than 3 decades. I stopped counting at 30 years. I'm at the top of my game. I got lots of material. And then, sorry, but not dental. So don't talk about anything of what you've got your expertise and knowledge about. And so when I learned about the spirit of the JD McLean, I jumped right at it. My university years were my favorite. In preparation of tonight's discussion, when I was considering what material that I could put together that was not going to have anything to do with my experience in dentistry, I thought if I could hit the rewind button and go back to when I was graduating, finishing university, about to venture into now a professional stage of my life, what do I wish somebody could have told me back then that I know now that I wish I knew more? So that's what I'm going to enlighten, hopefully, this evening. I had a whole ton of stuff that I had like for intro about how I came to be here, because you might think, well, why is this guy with dental background not talking about anything about dentistry? What has he got to offer? I had to cut all that, because in the end, I've got so much stuff I want to talk about tonight. You have no idea. And we have 45 minutes. So what I'm going to do is I'm going to touch on a number of items that for 5 years I was an instructor at a private hygiene college in Toronto. And same thing, I was asked to develop this college. They recognized that, as you all know, your curriculum is very intensive. And we were talking the other evening with one of the students about the number of exams. And Dr. Brooks was flabbergasted at the amount of exams that the students had to deal with. And so your focus and intent is clear, right? So narrowly focused, because it has to be. And so they recognized that the hygiene college, the Toronto College of Dental Hygiene and Auxiliaries. And so they said, Bob, can you put together a curriculum that kind of colors outside the lines and gives them a skill and expertise that is more sort of generalized outside of dentistry, that creates them as a better individual and therefore as a better clinician. So a lot of the things I'm going to be touching on this evening, or in the next 44 minutes, is a lot of them are half-day workshops, full-day workshops, or fairly extensive. So I'm going to be touching on a few of these things. I'm going to put them on the screen, and I'm going to invite you to my goal for this evening is that I can inspire and put you on a path toward becoming a more well-rounded, firmly grounded, enlightened individual who interacts with the world through successful interpersonal relationships. Sounds good, right? So those are some of the things that I was hoping that, and we're going to touch on. So if I could go back, what would those things be that I wish somebody could have told me? So recently, before we do, how many, can I just see a show of hands, how many are in the hygiene program? Nice. How many are from the dental program? And keep your hands up, those who are graduating this year. Wow, congratulations. I was recently watching on Netflix in the fall, I think just before the holidays to get ready for this evening, I was watching Dear Evan Hansen. Has anybody seen that movie? It's amazing, right? So if you haven't, it's on Netflix, look it up. It's a musical as well. The music's great, the performances are amazing, but the storyline is great. And the story is, essentially, it's about this socially awkward high school student whose therapist says every day to write a letter to yourself each day. And at the beginning of the movie, it starts with him typing, Dear Evan Hansen, be yourself. And that really resonated with me, because one of the first things that I wanted to talk about this evening is about being your authentic self. So what does that mean? As I was putting this material together, it was kind of interesting. I came across that Merriam-Webster. Merriam-Webster are the dictionary people. They decide what words and definitions are part of the dictionary. And because there was such a significant uptick of online lookup of the word authentic in 2023, it's the word of the year. And it's largely driven by conversation about AI, about celebrity culture, and social media. So it made sense to me that it's funny, it just resonated, and that it's very topical. If we look at, from a definition standpoint, in terms of what we're going to be talking about tonight is not false or imitation. My favorite is true to one's own personality, spirit, and character. I find the best way for me to make some points sometimes is through personal experiences. So I like to tell stories. So indulge me as I do. So I'm going to give some personal background. Dr. Ahluwalia mentioned that I did. I grew up in Winnipeg. I grew up in Winnipeg in the 80s, secretly gay. Not an easy time. Secretly, I mean, even secret to me, because I was so sure I didn't want to be gay that I'm not gay. I just didn't want to be gay, so it was even secret to me. I wasn't out. In fact, I didn't want to be me. I was just so not comfortable in my own skin, and so I just had to hide my authentic self. I couldn't be my authentic. I just didn't feel that I could. You think back. This was the time. There was no Will and Grace. There was no Ellen DeGeneres. I never knew through my entire high school years and university years, I never knew a single gay person. I mean, there may have been a gay person like me hiding, but it was just never something that was either certainly talked about. It wasn't supported. And so as a result, you just feel very sort of isolated, very alone. And to a certain degree, really, I guess, a feeling of like having no safety net. When we got into the university years, I got really good at hiding it. The best actor goes to Bob Hope. Into university, you go out, we go to bars. And so there would be times where, hey, let's go to a gay bar. And I couldn't do it because, what if I got recognized? What if someone saw me? They would know my bad little secret. And it was debilitating. And I'm sure at some point, a lot of us, at some point during our lives, we might experience that feeling of outside from or not part of, but wanting to be. And so people will often say, well, so they'll characterize going through that stage as self-loathing. And it sounds kind of harsh, like self-loathing. It sounds really and I just hated me. Okay, so it was self-loathing. So I didn't want to be me. And if you think back then to, there was just a lot of derogatory language. I mean, some of the things we still hear now, oh, that's so gay. And so the message, whether consciously or unconsciously, the message that you might listen to and maybe even buy into is, it's not good, therefore I'm not good. I'm deficient. I'm improper. This was also the time of the mid-early 80s where the AIDS epidemic was the onset. And it was characterized and known very much at that point as the gay plague. So just every reason why you just didn't want to. And I was in, my high school was a jock football high school, a very small school. And, just the language and you just couldn't, or at least I felt that I couldn't. So I did everything I could do. Not only tried to be straight, so I have my girlfriends. I got a girlfriend. I have a girlfriend. It never really lasted very long. And I even convinced myself, okay, I can do this. I can be straight. Well, then as I got a little bit older, then I'm now into university, and I would get questions about, so aren't you seeing anyone? What's going on, Bob? Oh, I'm focusing on school, right? Oh, I'm too busy. I'm focusing on school. I just don't have time for a relationship. When I was 22, I met my first boyfriend. His name was Andrew, and he was my first gay. He was the first gay person I ever knew, and it's not as though you taught, hey, are you gay? Well, I'm thinking about it. I don't really know yet. It's do you want to be gay together? I mean, so we met. So it's nothing that's really talked about. Drawn to. I'd never been so drawn to, and it was reciprocal, and you could kind of tell, and then we kissed. I was like, yeah, I'm gay. I'm gay. So, but then the charade continued. The thought of coming out, it was just dread, because it was either going to be, particularly for family, but it was going to be a disappointment. Who wants to be a disappointment? It's going to be, you knew it was not going to be popular. 2 years later, at the age of 24, Andrew and I moved to Toronto. And it was really sort of my second birth, because when I got to Toronto, Andrew had previously studied at the Banff School of Performing Arts. He had some friends who were in, I think it was Les Mis at the time, at the beginning of Les Mis and Phantom. They were actors, and they knew each other was gay. So when I got to Toronto, they just knew me. I mean, they didn't know me as Gay Bob, but I was Bob who was gay. But I was Gay Bob. I was Gay Bob. I was Gay Bob. There was nothing to hide, and so it was this weight and relief that was lifted. It wasn't until I was about, so the charade continued. Andrew and I, we had an apartment, 2-bedroom. We're just roommates. Andrew was a Winnipeg Jets fan. We had the Jets back then. I was a Winnipeg Blue Bombers fan. I loved football, so we were just a couple of guys who had an apartment with 2 separate rooms. And people would come over, we'd have to rustle the other one bed to make it look like, yeah, we're slobs, yeah. So it was only until I was about 28 years old when I thought the first person I'm going to come out to, we don't have enough time to discuss tonight the reason why, but it had to be my mom. And it did not go well. We had periods, years of silence. My dad, we never spoke. We never really had a father-son relationship. Never spoke of it. So it wasn't until 1997, so a lot of you are too young, a lot of you will remember. 1997, Ellen DeGeneres, so everyone knows like the Ellen Show and that she's out and so on. She had a sitcom in the mid-90s, and there's always rumors about, is Ellen gay, is Ellen gay? And of course, again, at that time, it was a career-ending decision if you came out. So Ellen decided, in Ellen's way, her character's name was Ellen in her show, and she had, Laura Dern was her girlfriend on the show. Not obviously, it wasn't really talked about, but she got to the airport, she was leaving, and they were sort of splitting up because whatever, and Ellen spoke into the microphone by accident because they were calling the gate, and so Ellen was having this very intimate, quiet conversation about, I'm gay. And so she said, I'm gay, into the microphone, and the whole airport heard it. It was sort of a funny laugh moment. But that's where she officially came out through her character on her sitcom. It was funny. Sitcom got canceled. She didn't have a career for a couple of years. And it was only when she was interviewed by Diane Sawyer, I think it was on NBC, might have been 60 Minutes, one of those shows. She was interviewed sometime after. And Diane Sawyer was trying to figure out, so like, what is that like? And, being gay and being hidden for so long and hiding it and not feeling, like you belong. You don't feel like you fit in. So Ellen is making her case and trying to explain it the best she can. And Diane Sawyer says, well, so I guess is that sort of like if like a black child in a white community or a white school just feels like they just don't belong. Is that sort of the feeling? And Ellen stopped and thought about it. And she said, well, I guess sort of. But the difference is, black child gets to go home and they're still with their black family. Gay child doesn't have that generally. Certainly she didn't, and certainly neither did I. You're still a stranger in your own home, and you don't feel maybe that you have that safety net. So looking back, I wish I had that strength of character back then to own my own life, to not stay hidden and maybe pursue the things that I wanted to. And sometimes you can't do this on your own. It was in my 30s that I'm a firm but big supporter of seeking out professional support and help. So I went through a period of seeing a therapist and kind of working through some of this stuff. And so for the challenge for all of you is you may and always follow your gut. You may come across at some point someone who you know very well and a close friend or whatever else. And if your instinct is they might be going through something, then you could potentially offer and be that safety net, because in some cases they just don't feel that there is, and it can be very isolating. And don't be surprised. So when you watch Evan Hansen, one of the characters, she's this young black woman, amazing, and she's Miss Popularity. She's like doing speeches in the school and doing all this stuff, and you think she's amazing, she's got it all together, and you learn that she actually doesn't. And so she felt sort of very isolated. So it's a really kind of cool. A cool movie to see and kind of experience and understand. So whenever you see someone, so Dolly Parton in the best little whorehouse in Texas, she has one of my favorite quotes. She says, if you ever see someone without a smile, give them yours. And God knows that this world is hard enough, right? And so let's be good to each other and have each other's back. Okay, so some lessons I learned along the way. So sort of a long intro to say, okay, about being your authentic self. Being your authentic self, so if I want to understand what that means, it involves a lot of self-reflection. So what I'm going to ask you and invite you to do is, maybe even starting tonight, this weekend, I know you're in the middle of school, so what I'm going to be bringing up and talking about that I'm going to suggest and offer you to do is some homework without a due date, and that you don't have to share with anybody but but yourself. So getting a pad of paper and writing a few things I'm about to give to you, and it's going to be an ongoing organic process for yourself. Because we're not used to thinking in some of ththese terms, and so when you start to, and you want quiet solitude, put some nice music on, kick your shoes off, chill, maybe turn the lights down, getting yourself in a really good, kind of very cool place. And we're going to talk about what self-reflection, well, what does that mean and how can I do that? And because you're not used to thinking in these terms, you're going to do what I'm going to suggest, and then you can put it away and go back to life, go back to class, go back for another clinic, go back to look for another difficult patient to work on, go back to life, go back to friends, and so on. And you're going to revisit this from time to time. And it's going to be an onion that you're going to be peeling one layer at a time and getting closer and closer to your personal individual truth. And don't be surprised that it's not something that is always just an immediate conscious thing. I'm going to sit down and think about who I am. I mean, you'll do some of that, but it will surprise you because once that sinks into your psyche, it's going to be ruminating in your subconscious without you even having to worry about it. The brain's going to be working around for you. You will come across times where you might be driving your car, you might be in the shower, you're going to be not thinking about it at all, and all of a sudden this thought's going to come in and say, I got to put that on my list. And you'll understand what I mean in a sec, what I mean by the list. But things are going to crop up that will surprise you. You're like, I wasn't even thinking about that. Or it might be like me, at 1 a.m, I keep a pad of paper with a pen next to my bed because I will very often wake up in the middle of the night. I did last night at 1 a.m. about today. And I had a couple things that I thought, I gotta cut that. I only have 45 minutes, but I'm going to add this. And I write it down because when I wake up in the morning, I used to have these, I would wake up and think, that was brilliant. What was it? I couldn't remember. So I'd write things down. All right, so as we grow and evolve and develop, I'm going to say different faces that we present to the world. So this is where you're going to take a pad of paper, and we have so in terms of a face, I have a professional self. This is the person who I choose to present to the world when I'm at work. I have a social self. These are the parts of me or who I am in public. An event like this, maybe out with friends. I have a personal self, which is who I am with my intimate, like my best friend, my BFF, my best friend forever, or my intimate romantic partner. And then we also have our private self, which is the parts of ourselves that we rarely show, maybe or never, to anyone. So what I want you to do is identify, so you're going to write these down and you're going to think about for each of these, well, who am I when I'm that person? And how is that different when I'm that one, the other, and the last? Who do I need to be? Because the truth is I need to be someone potentially in a work setting, which is maybe entirely different than when I'm by myself in my own thoughts. Who do I want to be? What does the best and most honest version of me, what does that look like? I mean, had I gone through this when I was younger, I would have at least started to consider some of the things that I felt very isolated from. And what are the challenges to that self, and how would I overcome them? And again, you're not used to thinking in these terms, so you're going to be like, why is he, Bob Hope, he said to do this. So you just do a mind dump, throw down whatever. There's no right answer, there's no wrong answer, but you're just going to, it's amazing what pen to paper does. Things will come out, you're like, where did that come from? And put it away. And the next thing that I suggest that we do from a self-reflection standpoint is now you want to identify, well, what are my core values? Like at my center. So core values, I want you to think of an apple has a core. So an apple has the skin and all the meaty part of the apple, and that's all the stuff, but the core is at the center. And so at your center, core values, think of it as your moral compass or your guiding principles, and they inform every decision you make. They are never to be compromised. They're at your core, and they are different for every individual. I do this exercise with teams to identify, well, what is our culture within this team? Because we're all individuals. We're a collective of people who are different, who have different sets of values and so on. What I would like you to do, and you might think, well, I don't know, where do I even begin? So I have an exercise that I can provide to you afterwards. Essentially, so I'll give you an example. So I've done this hundreds of times. I did it part of my curriculum at the hygiene school, and I've done it with teams and so on. And so every time that I do it, and I'll be driving away, and a core value for me, and the rationale behind it. So what I've done after this exercise for myself, just give you an example of where I'm going with this. My core values, I've distilled it down to really 3, and I tried to get it down to 2. I just can't. It's 3. My 3 core values, number 1 is confidence. I need to have confidence as much as I can in everything I do. And what I like about confidence is I want kind of embedded and maybe implicit in that is a certain level of competence. I don't want to be, we've all seen people who are false confidence. You can see right through it. They're like a paper dragon. It's like, nah. No, I want real confidence, which is based on competence. I need to be and want to be good at everything I seek out to do. So confidence. Little too much confidence spills into arrogance. So my second core value for me, humility. In fact, I want a slightly more concentrated dose of humility than confidence because that keeps me in check. And embedded for me, humility is gratitude. So I need to be grateful every day to whatever I can be. So you might be having a horrible day. There's always something to be grateful for. So I want to be confident. Humility and humor. You gotta laugh. I gotta laugh. So I try to embed, and those who know me know that is exactly who I am. Because I strive to incorporate those 3 qualities in everything I do and to never be compromised. I'm not always funny. I try to be. Okay, so I want you to think about core values. And again, I'll be able to provide you with some resources on, well, where do I get started? Because I've got, when I do it with teams, I have lists of hundreds of samples of values. And not that it's limited to my list, but hundreds. And you'll go through them, and again, thoughtful, careful intention, and go through them and think about it. It's like, yeah, that one is. So when I do this exercise, I ask people, take the list and circle 8. Circle 8. So go through and circle. And I said, okay, take some time, look at your 8, take 3 away. So go down to 5. And then you're like grumbling, oh, God, I don't want to get rid of integrity. I need integrity, but they're telling me to get rid of it. And you're going to define your own 3 core values. And you get, again, whittle it down, and then understand for you. And it's not a test, and it's not a comparison. It has to be what resonates for you. Then I want you to go back to that list of my professional self, my social self, my private self, and my private self. And layer your core values into, and you'll start, okay, so these are things that are important to me, and this is how, if I'm going to embed those core values into my professional life, which is who I have to be in a work environment, okay, my list is now getting a little bit more depth, and not maybe as thin. Once you've got your core values, this is one of my favorites, psychological types. So many of you have maybe done a personality profiling of some sort. There's the DISC, is a very common one, where you're a D, I, S, or C, and it's it's trying to sort people into sort of common types from a behavioral standpoint, because that behavioral description kind of gives you a bit of insights of like, oh, kind of that is kind of me. The one that I'm a certified practitioner is for the Myers-Briggs type indicator, the MBTI, the Myers-Briggs type indicator. It has its roots. Carl Jung, 1920s Swiss psychiatrist, developed a model, and in the 1950s, a mother-daughter psychiatrist team, Isabel Myers and Catherine Briggs, they expanded on Carl Jung's work and added another dimension. So in their work, there are 4 dimensions, and within the 4 dimensions are 2 components. So an example would be, and one that would be easy in today's context in my 38 minutes, is one of the dimensions is extroversion versus introversion. So we've all heard those words. And it's often misunderstood. People often think of extroversion as social, popular, and introversion, shy. And it's not that at all. Extroversion and introversion has more to do with how individuals experience energy. So extroverts are generized by interactions with people. Introverts, it depletes their batteries. So you can tell introverts immediately. So if we talk about our work self, so as you learn, I'm an introvert or I'm an extrovert. So how does that play into my professional career? So I've worked with clinicians. I had this one hygienist. She said, oh my good Lord, at the end of the day, I am just exhausted because I feel like I've been performing all day because it's a necessary, because in dentistry, in hygiene, we're interacting with people all day long. And you can tell an introvert right away, especially the dentists, when they're doing their work, whatever else, and then they seek solitude in their office. They might even close the door because they just need to chill, because they need to recharge their batteries. They experience energy differently. The other difference often with introverts and extroverts is extroverts, they'll problem solve aloud. So you will think, you'll ask an extrovert, hey, we've got this situation, we're trying to figure it out. And they will, and sometimes very confidently, but they're working out, they'll talk about it. And you'll think, wow, they've got it all figured out. But they problem solve aloud. Introverts, so often if you've got a team or a group where you've got a lot of introverts, people will say, God, we have meetings and she never says anything. She never contributes. And she's probably an introvert. There's no right or wrong about it. Introverts internalize. So they will take the situation, but they're not the extroverts. So the spirit of so with Myers-Briggs Type Indicator, there are potentially 16 profiles. It is incredible. So you fill out, there's an online questionnaire that you fill out a bunch of questions that are, in this situation, I would probably A or B. And you circle whatever resonates the most to you. And again, shoes off, relaxed, comfortable, your private self. Because the reality is, so when I've done this with a lot of dental professionals, like, well, kind of both. And sometimes it may be, but I always remind them, your personal, individual, private self that nobody sees or knows. That person, not your work self. My work self, well, I got to be an extrovert. I got to perform. But at your core, maybe that's not who you are. So understanding that distinction. So sometimes doing these, so when I administer the Myers-Briggs Type Indicator, I provide some coaching as well in terms of preparation, in terms of how to fill it out. And then you get this really amazing, cool report in detail, talking about what your, and I did this with one doctor, he said, is it bad? And I said, okay, it's not a personality dysfunction. It's a description of what your natural tendencies are. So from a personality profiling standpoint, our mind is active in two ways. One is we observe the world around us, and we take in information, and then we process that information and make conclusions or decisions. And some people do those in different ways. So in the Myers-Briggs Type Indicator, I'm an ESTJ. So those are the four components. Of the Myers-Briggs, there are 16 potential. Think of it as a house with 16 rooms. And I occupy the ESTJ room. I am an expert at ESTJ. I understand ESTJ completely. INFP, I'm not so sure. I don't really understand how they see the world necessarily. And the purpose of the Myers-Briggs is to learn and understand what is natural to you from a temperament standpoint. An easy, simple example would be, in terms of preferences, is I happen to be right-handed. That's my preference. It doesn't mean I walk around the world like this and I don't use my left arm, right? When I drive through Tim Hortons and I get my coffee, that individual has no idea if I'm right-handed or left-handed. I still use and have to develop that muscle that is not familiar to me, not natural to me. And it's the same thing from a personality standpoint. So the idea of this exercise is to find out, well, what's natural to you? And maybe what are your blind spots that are your left-handedness from a personality standpoint? And those are the things. What it is not meant to do is to say, well, here's my report. That's just me. That's how I am. It's like, no. It's not. It doesn't excuse bad behavior. So it's meant to learn about yourself and what those left-handedness things are, and to develop them so that you can understand your other team members. So by going through that and understanding what those things are, you're going to go back to your list, and that adds, start peeling back the onion a little bit more and understand yourself even a little bit more, because you'll know right away. And sometimes it's not always bang on. It's an amazing exercise to go through. You will learn a bit about yourself, both in terms of what's natural to you. It will resonate. You'll spot it right away. And the things that aren't, with some suggestions on, well, what do I do with that? And how can I learn that and apply it more productively within my personal relationships or in a work context. The next thing I suggest is be your own observer. So in his book, The Power of Now, Eckhart Tolle, he talks a lot about the power of now being present, and he talks a lot about keeping your ego in check. It's a great read, so I recommend it. I can provide I'm going to talk about other books, reading materials. But he talks about being your own observer. And your own observer is kind of turning the mirror on yourself and being aware, not just of your actions, but your reactions to situations. To give you an example, well, I'll give you a couple examples in terms of how I was my own observer. When I got into rowing, and I was competitive rowing. And so we had a gold medal Canadian from the women's 8, was one of our coaches, and we had like an amazing coach, and it's intense. We're on the water at 5 o'clock in the morning every day, and we race every weekend. It's intense. And so during our coaching, part of our coaching would be, and it's all about, so in rowing, either single, so I was doing sweep first and then sculling, but sweep, I was in a 4. So there's four guys in the boat. And so our coach would go along in a coach boat and videotape us. We'd go back into the boathouse, throw it up on the VCR, and we would watch it like literally frame by frame, like click, click, and we would see the timing, because rowing is all about 4 individuals acting as one unit. Doesn't matter if one person is like, oh, I'm stronger than he is, and well, then the boat's going to torque. So it's got to be functioning as one in unison. So adapting to each other. Not finger waving and fault finding, which a lot of us can maybe very quickly and easily go to. And I certainly did. So I just so you know, I was the perfect rower. Rob, behind me, kept screwing up. God, Rob. And I was like, oh, you're always late. You're always late. Rob. Go in the boathouse, we're watching frame by frame. And so this is essentially, I was my own observer because it was on a TV set. So it's a form of biofeedback. Powerful. So we're watching it, and like watching the blades pop up, start to feather, pop in the water, and push. And I was consistently early. Rob wasn't late. I was early. He was doing it was very humbling. It was a whole paradigm shift. Whole paradigm, my whole outlook in terms of, and that's where I became sort of my own observer of, instead of focusing on worrying about and thinking about the efforts and activities of it, just what am I doing and how does that contribute to the whole? And if somebody's struggling with something, being supportive of it as opposed to blameworthy and fault finding. Another example of being my own observer. So as Dr. Alawali said, Rex and I, so Rex, and he mentioned in the shadow of my partner. So Andrew and I busted up. Shortly after I entered therapy, during the therapy, he was like, yeah, we're done. Good guy, but I was 2 years, I was like, I'm single, I'm done with this relationship thing, I'm good. I've never been so comfortable in my own skin, I'm good. And then I met Rex. Rex Harrington, so if you Google him, not now, put your phones away, but if you Google Rex Harrington, he has a star on the Walk of Fame. He has an Order of Canada. He has a Gemini Award. Like, he's kind of a big deal, and I had no idea. So he's one of Canada's foremost male ballet dancers. He's performed on every major stage around the world. I never saw ballet, so I didn't know who he was. I was just like, I want to meet that guy. And my friend said, well, that's Rex Harrington, so I should know who that was. I said, well, like, what, is he a porn star? Like, what? Because it's kind of a killer name, like Rex Harrington. And he smacked me and said, he's a Canadian icon. So we've been together now 20 years. I've got lots of Rex stories. But so Rex and I were on season 2 of The Amazing Race Canada. And really when a lot of your behavior, when it really starts to show some of your ugly side, is when you're under intense stress and pressure. And there are those moments in The Amazing Race. I gotta tell you, so The Amazing Race, so when we got chosen, they said, so you're gonna be off the grid for 6 weeks, so you have to come up with a reason, because nobody's allowed to know that you're on the race. So you have to come up with a reason why you're literally you disappear. That was a whole challenge. I've got a story about that. I don't have time for it yet. It might come up in the Q&A. But, so they said you have to pack for every potential weather condition. So we knew there's always something winter, there's always something like summer and so on. And so you need boots or a toque, but then you need shorts and they provide you with nothing. They said, pack for every weather condition and it has to fit in a carry-on. So there's no checked baggage, like it has to fit. So we went down to MEC and got, sort of that, the big knapsack that would fit and then went shopping and got like tons of stuff. And I had both of our knapsacks like just because, I mean, come on, we're 2 gay men. I can't be seen wearing the same thing twice. And that was sort of a metaphor. So we were the year with the 2 women from Team Canada who won the 2nd gold medal in hockey. So they were on our season. And I swear to God, like I think they packed like in a little fanny pack. They would pull out this little Lycra thing, put it on, and they wore the same thing every day. Meanwhile, no word of a lie, our knapsacks were close to 50 pounds each. So the metaphor is, we're carrying around a lot of baggage unnecessarily that is pulling us down. So pack less. That's a tip. So in The Amazing Race, in terms of getting back to being your own observer, I was doing a challenge. So I had done the Myers-Briggs on both myself and Rex, and so I knew what our individual sort of proclivities and strengths and preferences were. And so we knew there'd be certain challenges that when it's one of those, I'll do it. When it's one of those, Rex would be best. So anything that would be creative, because I am not creative. I'm numbers, I'm memory. There's always a memory challenge. Like if I were to say, Rex, make a spreadsheet, he would probably go to the bedroom and make the bed, because he's spreading a sheet. Like he would have no idea what Excel means. And I am not creative at all. So on this one challenge, we read the clue and they trick you. So we guessed wrong. So there I am doing, and so there was a pile of driftwood, sticks, and a net, and some rope, and a pile. And they have a sample of a chair with the net and the rope, and it's this beautiful chair, and they make a chair. And so and I had to do it. Because Rex had done the previous one, so I had no choice, so I had to do it. I am studying this chair. I was literally the XY coordinates trying to figure out, I was going back and forth. The other teams, like they're throwing their crap together, and it's all like, and it had to support yourself. So it had to be a chair that you could actually sit in. And I spent hours on my chair. I looked at it and I was like, it's not exact. And so I discovered, being my own observer, I'm a little bit of a perfectionist to a fault. I took it all apart, started over. And as I'm doing that, I saw the other chairs that looked like kindling in a bonfire. It was like, and I see, here's your clue. I was like, they got their clue for that, and I had my chair. So I was like, screw it. We took a penalty. And so here I am on TV. I'm watching, and we didn't know what they're going to edit, what they're going to show. And I'm literally throwing stuff at the TV. It's like, what are you doing making your chair? I had, the guy even said, I don't know, I took a penalty. He said, your chair was better than anybody else's. Like, well, yeah, it was like perfect. Now that I see the other ones. And so those were easy ways that I could be my own observer. But I'm going to talk a little bit more about being your own observer in terms of just your where you're not on TV, but where it is a reaction that you think you're part of that you weren't really proud of, and you think, what was going on, Bob? So be your own observer, and then dream. So as you put together that list and you have an idea of yourselves and start peeling back and layer on in your onion, I want you to think about, so in 5 years, who will I be? Maybe that is same or different than now, what needs to happen? What will I be doing? Who's going to be around me? Where will I be living in 10 years, 20 years? So having self-awareness and acceptance of that self-awareness, it's a good start. And this is an ongoing timely thing, and it's for your own private personal agenda. And again, doing some of these exercises will help fill in some of those blanks and kind of get those juices in your mind going, where you will start getting a better sense of who your individual self is and how, and getting, as I mentioned in the outset, being well-rounded and firmly grounded in who you are and comfortable in your own skin. But we have to remember at all times, okay, great, but we're social creatures. We interact with a lot of people. And generally, often, people who are different than us. So when people are different than us, we're like, wait, what? Like, that's not how I see the world. So when that happens, so when we get along and everything's going fine, everything's great. The true acid test is, well, but what happens when it doesn't? Or if there's adversity or differences or disagreements, or if we bump elbows? That's the real acid test. Then what? Then how do I, and not that other individual, but how do we respond? So the most obvious thing is, let's talk about conflict. If you're like most people, if I were to ask, do you see conflict as an interesting conversation or often as an attack? And most people say, door number 2. Oh, I don't like conflict. I don't like conflict. And that's because, kind of like doing the Myers-Briggs type indicator, it's a trained thing. And so dealing with conflict, people generally just deal with conflict, and so they do the best they can. That didn't go really well. They hated how that felt and never want to do that again. It just means we're not skilled. Conflict is inevitable. Conflict just means I've got two individuals with two different opinions. It doesn't mean it's a fight. That might be sometimes the end result. With conflict, I could have a vegetarian and a carnivore. It's just two different opinions. It doesn't mean one is right and one has to be wrong, and it doesn't mean it has to be a fight. But often people they're not skilled at dealing with conflict. So something I want you to think about as well, so I do this, I've done this with a lot of clients and with teams, but with individuals is, so the Thomas Kilmann instrument it's a sorter. It asks you to consider, there are 5 ways of dealing with conflict depending on the situation. And they chart it on an XY sort of axis, one of assertiveness, so highly assertive or not assertive at all, and cooperativeness, so not cooperative at all and very cooperative. So if I'm highly assertive and not cooperative, that conflict style is called competitive. And it is win-lose. It's like, I'm going to win, you're going to lose. On the other end of the spectrum is very, very, very high cooperative, meaning I'm looking after everybody and probably me the last or least. And assertiveness, not at all. And that, on the other end of the spectrum, is avoiding. So I avoid. And we all have a preference, just like personality profiles. And what that preference is, that's what my go-to is. That's where, in a conflict situation, I generally kind of deal with it this way. And a lot of that is a learned behavior. It might be cultural. It might be home, the home, or it might just be from experience of dealing with situations and it's fight or flight, and that's all I know. Because this is a skill like any skill. You don't read a book, you don't open a Cracker Jack box and get a dental degree. It's a skill that you have to work at continuously to build up that muscle and get good at. Dealing with conflict is no different. And generally people don't, and so then they don't like conflict. And yet conflict is an important part of interpersonal relationships. So the real issue is we all need to, wouldn't it be nice, to be able to understand, well, what are those 5? Because I've had people say, well, so what should I be? Like, is that good? And the reality is they are all 5 relevant. It just depends on the situation. There are times where a competitive approach to a problem-solving conflict situation is absolutely appropriate, and sometimes avoiding is. So you want to find out, well, what is natural? What's my go-to? Where do I go? What do I do most? What's just comfortable? And what are my blind spots? So what do I need to learn about those other ones, and how would I language those situations, again, to affect a more positive outcome? So that's where you become your own observer, that you're seeing a situation like, that just didn't go well. Retreat, Go back to your car, go home, think about it, maybe tomorrow, maybe on the weekend, and then self-reflect. It's like, okay, well, like what happened? Like that, I definitely don't like that. So if I hit the rewind button, I can't control their behavior, but if I did something different to affect a more positive outcome, what might that look like? And then try it. The next is, in terms of developing interpersonal relationships, is perspective. One of my favorite authors, Stephen Covey, in his book, Principle-Centered Leadership, he invites us and asks us to, he says, seek first to understand, then be understood. Seek first to understand, then be understood. So think of it this way. We've all gone to soccer game, hockey game. My favorite is football. I said that earlier. So we're at a football game. Let's say my team is down here near the end zone, near the uprights, and we've got the ball. And I'm sitting high up in the bleachers in the cold in Winnipeg. We would literally be watching football in November. And crazy. And in the cold. And when everyone clapped, it was like, because we're all wearing mitts. So there's my team, and the quarterback throws a long bomb, and the receiver's he's so fast. He's way down here. Wow, it went so high. That ball, and got a touchdown. Amazing. Meanwhile, over here in the end zone on the other side is someone watching from this viewpoint. And all they see is a bunch of guys down there, and the ball kind of went up like that and down here, and there's the guy. So that person may say, well, no, it wasn't really that far. I mean, there they were, and here he is, and it's like, it wasn't that big of a deal. And from my perspective, like, oh my God, yeah, it was. And it's just a different interpretation of the same events. We just have different perspective. Doesn't mean I'm wrong or you're wrong or I'm right and you're not. And yet people argue about this type of stuff all the time because they dig in their heels and they have this need to be right. Because if I'm not right, then I lose. Or if you're right, then I'm wrong. And then they argue. Seek first to understand is, you have your perspective. I know what I saw, so park it. Through careful questioning, communication skills, bring yourself as though you are snuggled right up next to them on their side of the football field, and through careful questioning, with an open attitude, find out what their perspective is and try to understand. And you might actually find that you learned something. I don't need to be right to learn something. I can still, and then you can always go back. Your perspective's sitting there waiting for you. It's never gone anywhere. But seek first to understand. And then say, hey, well, come to my side of the football field. Here's what I see. And they may be, I never thought of that. And you have a more collaborative conversation where we're still honoring each other's experiences and where it's not a right or wrong. And people tend to argue about things without asking and being interested and curious about their perspective more. So to be respectful of others, in other words, it means to truly understand them. People gravitate to where they feel understood. She gets me. He gets it. So in his book, David Kiersey wrote a book called Please Understand Me. And I read this quote every time I talk about this content. And pretty much every time I do, people come up to me afterwards like, can I get a copy of that? I want to send it to my husband, or I want to send it to my girlfriend. So I'm going to read this. If I do not want what you want, please try not to tell me that my want is wrong. Or if my emotion is less than yours or more, given the same circumstances, try not to ask me to feel more strongly or weakly. I do not, for the moment at least, ask you to understand me. That will only come when you are willing to give up changing me into a copy of you. I may be your spouse, your parent, your child, your friend, or your colleague. If you will allow me any of my wants or emotions or beliefs or actions, then you open yourself so that someday these ways of mine might not seem so wrong and might finally appear to you as right for me. To put up with me is the first step to understanding me. Not that you embrace my ways as right for you, but that you are no longer irritated or disappointed with me for seeming waywardness. And in understanding me, you might come to prize my differences from you, and far from seeking to change me, preserve and even nurture those differences. Wouldn't that be nice in every relationship? So to truly understand someone, coming to their side of the football field means just being more curious. One of my favorite sayings is, we have 2 ears and 1 mouth. Use them in that proportion. So through, as I was mentioning, careful communication skills, careful questioning, we want to invite conversation where I might ask a really good, well thought out question, and then I'm listening twice as much. So I'm engaging my communication partner, whoever it is, to do more talking so I can gain understanding, as opposed to me talking. And so in other words, it's a more outside-in approach. And so something I want you to pursue and look into is then motivational interviewing. I do a whole workshop on this. And motivational interviewing is a communication style. Its roots are in psychology, predominantly dealing with addiction cases. And the challenge with motivational interviewing is very conversational, and so it takes time. So there are certain, and so I've taken this in a dental context, because in a dental, not that I'm talking dentistry, Dr. A, but I'm just gonna touch on one little thing. If I'm a hygienist, or if I'm a dentist, and hygienists will get this all the time. Are you brushing? Yep. Are you flossing? Yep. Yep. Recline. Get in. It's like, no, you're not. So it shows that line of questioning often doesn't really get us to the truth. So a more open-ended question might be, so tell me how you look after your teeth and gums now. And then be quiet. And begin a conversation. If you do the same thing with patients, are you taking your medication as prescribed? Because it's a leading question. Yeah, I am. Yeah. As opposed to, so when are you taking your medications now? With dinner? No, empty stomach. Right? So you get more closer to the truth with different careful questioning. Communication is, we all think we're good at it because we do it every day. But it's a skill like anything else that we want to develop and improve on. Communication it's a thoughtful intent that goes to the brain, as opposed to words that just fall out of your mouth, that just are noise to the ear. So we want to learn to become better communicators, and through motivational interviewing. So we'll pursue and look into that more. The last thing I'm going to talk about, and I'm going to summarize and wrap up, is then accountability. So this gets back a little bit more to observing your own observer. As you go through that, and just in life. I've gone through all these myself, and yet I still will have challenges, and we'll have emotional reactions. So I want to talk about accountability. We're going to have emotional reactions that are going to be inappropriate. And that's just called life. The real issue is, what to do with it. Again, why did I react? I'm going to give you an example. So Rex and I, we were about a year into our relationship, and we were friends, took us out for dinner, and we went out to a bar afterwards. And these friends, I think they knew or set him up or whatever with his previous boyfriend. And so I'm the new boyfriend. And so there we are, and we're at the bar. I'm with Nick and Trish, and they see, there's whatever his name is. And so Rex got up and went over to say hello, and so I'm about a year into the relationship, and we're chatting, and he's there for quite a while. And then at one point, Nick went over, and so he sat down, and they're chatting, and I'm feeling sort of like isolated and insecure, and I'm not good, and eventually Rex comes over, and we leave, we're going home, and we're in the car, we're driving home. We lived in the west end of Toronto at the time, and I'm suggesting, he's driving, so because I'm a bit of a control freak, turn here, turn here. I'm telling him how to drive. Turn here. And he didn't want to turn there. He was going to go his way. And so we went through the light and didn't turn. I'm getting upset and angry. And I said, turn on this, going this way. And then I drive a lot. And so I know the faster way. I know better. I'm right. I'm Bob. And he doesn't. We get to the next stoplight. I get out, slam the door, and I walk home. About an hour later, I get home. The whole time that I'm walking, I'm like, where is he? Where is he? He's not coming? Then I get even more. There's a mushroom cloud over my head. And so I get home, and he's sitting on the couch. And I my father never would have let my mother walk up. And stomp upstairs, go to bed. an emotional reaction, inappropriate. So I woke up the next morning, and I'm always up early. I made coffee, and Bob, what was that about? Like, what happened? And the more that I thought about it, I had this insecurity. So getting back to where I started at the beginning was, I was given messages that I bought into that I'm deficient, that I'm not good enough, I'm a fraud. What if they find out? And that's what was happening is I was insecure that, really the truth of what was happening, which I found out the next morning, his ex was giving him a really hard time, and Rex was struggling. And he really could have used some support. And I was too caught up in my own head, in my own insecurity of it, and it wasn't obvious to me. So our insecurities are there. And the more that we explore and identify ourselves and as I peel back that onion, then it became really, really clear to me of really what was going on. It was my insecurity. And so I said to him, of course you're going to drive however you want to drive. I have no business in telling you how to drive. I was an idiot, and you did the right thing by making me walk home, and I apologized. And I owned it. So I've gotten really good at dealing with those. So George Michael has, in one of my favorite songs of his, it's a lyric that says, all those insecurities that have held me down for so long, I can't say I found a cure for these, but at least I know them, so they're not so strong. And so I've gotten really good at identifying and knowing, there he goes, there's that. And this happened at some point last year with a colleague of mine who's turned into a very good friend, sent me an email questioning the work that I was doing with one of his clinics, and he said, well, Bob, when you go in, don't you deal with this stuff? And I personalized it. I gave it to other people to read. And I said, look, you tell me, well, sounds like you don't know you're not doing your job. So and so I typed this and sent it back. And I hurt his feelings. I was actually mean, and involved my support rep, Dawn, who's worked with me for 28 years. She got involved. It's Bob, what's going on? And you guys have to work this out. And it was that which I thought I understood, whatever. It was like a harpoon that went to this raw nerve, and I had this emotional reaction. And I don't think I ever really officially apologized. But you learn. And then you do better, and with that knowledge and information. All right. So, this is my summary. So, if I could go back, if somebody could tell me what I wish I had known, do your personal inventory. Balance guidance. Up until now, most of you students have been intensely scrutinized and guided, whether it's parents and then teachers and now professors. And you're about to embark. You're going to pivot, and you're going to start owning your life in a whole different way than maybe you did before, where decisions were made or where you felt obligated to follow certain instructions. Now they're yours. So balance guidance. Everyone has an opinion, by the way, and they're not always right. Follow your gut. So balance guidance. Be grateful for their input with what's right for you, with personal responsibility. Define your authentic self. Do those four. Keep and going back to it and identify and define. Define those core values. Learn your personality preferences. I would urge and recommend Myers-Briggs type indicator. Be your own observer. And own your life with relentless energy. From a communication standpoint, let's improve some of those communication skills by being more curious. When I say by being more curious, I've got two people, and I have one lemon. They both want my lemon. What's the best way to resolve that conflict? Right. Most of you said cut it in half, I heard. And you're exactly wrong. You're exactly what the Myers-Briggs type indicator would indicate that people who are interested in dentistry, we gravitate to. What is that characteristic? We like to decide things, make a decision, move on. We're fixers. And so what you did was you weren't curious. You made a decision for it. What you didn't say, well, so Sarah, if I give you a lemon, what would you do? And she may say, well, I just discovered the Mediterranean diet, and I heard about this thing called zesting, so I just need to take the rind and zest that lemon. Or it's Martini Friday, and I need the rind for my martini. And then I asked Dr. Ahluwalia, and he says, well, I'm really digging that lemon water in the morning because I don't get why it's acidic, but it turns into alkaline. I want the juice. And by you deciding I'm going to cut it in half, congratulations, you made 2 people dissatisfied. Whereas you could have made 2 people 100% satisfied by asking a question. If I gave you a lemon, what would you do? I can make you happy, but we don't do that. We tend not to do that because that's sort of we're fixers. So we like to, I'm going to decide for you, I think I can figure this out, done. So we have to stop cutting lemons in half. Be more curious. Seek first to understand. In other words, the football field. Get on their side of the football field. You understand yours. Learn about their perspective more. Learn those conflict styles and understand when and how to use each one appropriately, and then explore motivational interviewing. And most importantly, what I want you to leave with tonight, pack less. So this is officially my exit. It's an exit. So there's a Bob Hope Drive in California. A friend of mine was driving home. She pulled over. She's like, Bob, you have an exit. So Bob Hope, if you Google Bob Hope, those who don't know who Bob Hope was, he was the biggest name on the planet, and I have an exit. So this is my email and cell number. I leave myself always available. So if any of this was interesting or intriguing, and I want to get that list of core values and I want to work on that myself or whatever, or what were those books you suggested and so on, feel free at any time. I always do get back. It often might take a day or 2 or whatever, because I usually don't have my phone with me when I'm but I always do get back. So feel free at any time to reach out and begin that journey. And that's all I have to say. Thank you. And now we're going to do some question and answer. How are we for time? What was the finally time slot? A little over?
Don't worry.
Oh! See, I'm the perfectionist.
That's all right. We forgive you. That's great. So first of all, I'd just like to introduce myself. My name is Jared Bush. I'm a fourth-year dental student at the Faculty of Dentistry at Dalhousie University. And I'm very excited to be moderating the question period this evening. Bob, I'd just like to say on behalf of those in attendance tonight, I would like to extend our gratitude to you for delivering an engaging and insightful presentation.
Thank you.
I feel like I cheated a little bit by preparing this before I listened to the speech, so I had to add a couple notes in as we were going. I just want to say, when you began and you shared some personal stories, I think for all of us, I know I can say for myself that learning about somebody's personal stories like that, it makes you really appreciate what somebody has to say. And that was a very empowering
Thank you.
story that you told us. And also, I know that you probably have a lot of practice, but your ability to speak is not something that can be easily taught. This is a talent of yours, and you did an amazing job this evening.
Oh, stop.
I also just want to say, and this is the part that I prepared before.
Okay.
By no fault of our own, we can get caught up in the clinical aspects of our job and our education, and fail to recognize our peers and our patients as unique individuals that can provide value to our personal and professional lives. Thank you for that reminder as well. With your background as a competitive rower and contesting the Amazing Race Canada, you've had to learn how to rely on your own skill set, but also how to be a good teammate. Mm-hmm. So thank you again for offering your perspectives. I'd like to ask for another round of applause.
Oh. Thank you.
So now I'd like to welcome some questions, and I'm going to start first, if that's all right with everybody. I wrote down a couple of things, and you conveniently started answering my questions as I wrote them. Well done. When you were speaking about your authentic self, this is going to be a long-winded question.
Okay.
Because I have some background to add. When I went to university, when I was doing my undergraduate studies at St. John's, Newfoundland, I worked at a restaurant bar. And then that's where I perfected my service voice, which turned into my patient voice. So my question is, how can we as professionals develop ourselves, and you touched on this, but develop ourselves to bring that, that actor that we're being closer to who we truly are, to reduce that exhaustion that you touched on, if possible at all?
Okay. Thank you for that question. What's interesting, and I've certainly discovered this consistently over the decades, is if you're like most clinicians, your dentistry is probably better than your talk about your dentistry. And so what can get kind of exhausting is because it's a time crunch. And so we're measured in maybe 10-minute or 15-minute increments. And then there's the next patient who is up and so on, and hygiene checks. So there's a real demand on time. And so we think we're making it as efficient as possible. And so we throw, it's like we're throwing spaghetti on the wall. We throw so much information at the patient, hoping that something's going to stick, because I got to go. I had a situation with a client, and I was there to observe and watch and listen to some of their language skills. And so in this case, the doctor came in. It was a 61-year-old patient. She was in for her hygiene. It was scaling only. No doctor was coming in the room. So he was already busy working on another patient. And the patient took out her partial. And as she did, she said, oh, yeah, it's just a little loose. So if you can tighten her up, it'd be great. Puts it in the cup. And I was like, ooh, because it doesn't work that way. We don't have a tool. Like, the tooth is mobile, so this is going to have a whole conversation. And the patient was coming in for a dental appointment, so she thought she would bring it up. So she calls in the dentist, who's interrupted because he wasn't expecting to be there. So he comes in. I'm there. They have a treatment coordinator, so they called. So Gail comes in. So here's the patient, the hygienist, Gail, the doctor, Bob. Like, we're all like, and of course the patient. And so the doctor wasn't expecting to be there, and so he's a. And I generally understand what's going on. I've been around a while, and so the patient says, okay, well, is this going to be like $10,000? I push, right? So she felt it was information overload. Wasn't expecting to hear that. She was expecting. And so we then go to lunch. So I'm making my questions. Go to lunch. We had a team meeting at lunch. And we're all sitting around the table. And I said, oh, so doctor, on that patient in so-and-so's op, I wasn't sure which teeth were involved. And he does a lot of surgical placements of implants. And I said, which teeth were? Gail, oh, yeah, thanks, Bob. Yeah, no, I wasn't sure either. I was like, oh, you didn't know, and you're the treatment coordinator. So congratulations, doctor. You managed to confuse everybody in the room. Well done. And he said, I got a little defensive, and he said, well, Bob, like, am I supposed to say nothing? And I said, well, no, but if the thought, I said, you have a treatment coordinator. I said, if the thought ever crosses your mind, like, do I have enough time right now to communicate the volume of information that I need to, so that patient satisfyingly understands everything, options, whatever? If the answer is no, then don't. It doesn't mean walk out and say nothing, but there's a happy medium. And I said, so we need to pick our battles wisely and plan more. And again, he was cutting lemons. And I said, so the ideal would be, you know what, of course. This is where we get into, the industry has really moved away from just single tooth dentistry. In a lot of cases, it's like, that's a tooth, I got to fix it with this, as opposed to more comprehensive and understanding occlusion. There's potentially a lot more at play. And at, a quick, it wasn't even a recall check. The doctor wasn't even, so it's a mini little speck where he was rushed in and out. It's not that. So knowing that the patients always have a lot of questions. It's always, well, how much is that going to cost? And does my insurance cover anything? And how long is it going to take? And is it going to hurt? And what are my options? Well, option number 2 is then we go down that rabbit hole. And so would be, I said, to give the patient hope and excitement and say, it's an amazing time in dentistry. There's so much that we can do. Of course, you've got a lot of questions. It's always the same 5. And I want to make sure that we give you all the information you need. The truth is, I need some time. Me and Gail are going to sit down and need to put together some ideas or some options. And I want to make sure that I give you time and opportunity to ask all the questions and present all the information. And I just need some time to do that. So I'm going to ask Gail to arrange a time for you to come back sometime next week. Come in for a cup of coffee. It won't be a treatment date. Have a sit down and have that conversation. And so instead of being like, because when the doctor is stressed, it's like scorched earth, right? So then everybody's like, And so we can avoid those situations and just being more sort of strategic. And that's why God created tomorrow. It's okay. Like, don't try to do everything now. And so that kind of creates a lot of that sort of stress that maybe could be avoidable.
Great. I'll ask the audience if they have any questions. In the interest of time, we'll accept a couple, and then I believe Bob will be here for the reception.
I am.
Anybody who wants to speak afterwards, I'll be here.
Come on. Yes.
How do you go off the grid for 6 weeks?
Great question. Oh my God. Because I said if I can. Oh, good. I'm glad you asked that. So Rex is with the National Ballet of Canada. He's now coaching. So it wasn't unusual for him to say that he was setting a ballet in Stuttgart or in Paris, or so, he's and what setting a ballet means is going to another company around the world and taking that ballet company and coaching and teaching them the steps and so on of that ballet. So everybody would buy into that. That made sense. I'm involved with my clients. As I just told you all, email me, text me, I'll always get back. And so for me to not, so when we got chosen, I said to the producers, I said, okay, so like during the race, like if I get an email, I'm gonna reply and you can read it first, right? So it's not like I'm gonna send an email, oh my God, you're not gonna believe what just happened, amazing race. And then he's like, no, Bob, there's no communication with the outside world, like for the 6 weeks, like you're literally off the grid. I was like none? I can't eat, I can't anything? He said, no. I said, well, what do people do? That's for you to figure out. So one of my former students at the hygiene college, I was asked by Philips of Philips Sonicare to facilitate a roundtable discussion around the connection between oral health and systemic disease and overall well-being and health and so on. And it was a great conversation. At the end of it, two of my former students came up and said, Bob, we miss you. We're taking dentistry in Melbourne. We're in Australia. We did our hygiene for a bit, and we got into Melbourne, and we were telling the dean about your lecture, about your curriculum, because it's so desperately needed. Yours was the hardest course because I forced them to kind of work a part of the brain that they thought was dead, but had a very dim pulse, and we read it was clear. And they said it was such a great course, and it made me a better communicator with my patients. And so we're telling them, you got to come down and teach. And I was like, oh, awesome. So I'll check into that. And I forgot about it. So when the race came along, I thought, that's where I'm going to be. I'm going to tell everybody, because I thought I got to be on the other side of the planet. So a few months in advance, I started telling a lot of my consulting clients who I'm in touch with all the time, and said, I've been shortlisted. There's a dental school in Melbourne. I've been shortlisted because I have a whole curriculum. So I submitted my curriculum that I did at the hygiene college on communication skills, on self-enlightenment and so on. And I've been shortlisted. Down to me, it was before Zoom meetings. And so we had a Skype meeting, and I gave your name as a reference. So if you get a phone call, her name is Dr. Isa Pavre. So if you get a phone call from her, that's what it's about. So in French, those of you who know, pas vrai, not true. So I'm saying, so if Dr. Isa Not True gives you a call, then that's what it's for. So every time I'm telling my clients, so if you get a phone call from Isa Not True, I'm like having my own little giggle. Of course, I never got a phone call, but then I got picked, I got chosen, so I'm flying to Australia. I'm going to be doing a 3-week intensive, and since we've never been there, Rex is going to meet me there, and we're going to go backpacking in the outback, so that I would be literally off the grid. And I got to the point, I had to tell my own staff. So the week before the race, I went to Dawn, who's been with me for 28 years. I met with her and I said, okay, so I have to tell you something. And she said, what? I said, no, it's not bad. I'm not going to Australia. She said, what? I said, I need you to sign this non-disclosure agreement. You can't tell your husband. You can't even tell your dog. Like, you need to, so read. And it says, that was going to be on the amazing. She's like, no way. I said, so you need to cover for me. So, I got so much to the point that I was getting excited to go to Melbourne and teach this course. I was like, oh, that's right, I'm actually not going. And so that's how I got out of it. And it was a close friend of mine, when we got back, she said, well, you're going to have, because we got back at the end of June, but they didn't air the show, I think, the end of May. The race runs in the month of May. They don't announce the teams until June. So we were back from Australia, and she said, before they announced the teams, And so she said, you're going to have stories. People are going to say, oh, let me see your pictures. And so where'd you go? Did you see a dingo? I was like, never been before. So I was like, so I avoided everybody because I couldn't come. I was doing research and trying to download photos. Like, I can't fake it that well. So that's how I got. So if I ever say that I'm going to Melbourne to teach at another school, there might be something else going on. Any other questions? Come on. Come. Don't be shy. I think it's time for food. Okay, so venture out, become stronger individuals, find your authentic self, embrace all your flaws. Don't be shy of your insecurities. Harness them, own them when they flare up, and you'll have better relationships, profoundly different relationships. So stay in touch. Thank you. Let's eat.
Thank you again, Bob. Just on behalf of the Dalhousie Dentistry and Dental Hygiene community, I would like to present this gift of appreciation.
Aw. Yee, thanks.
Very welcome.
I'm a Dal. Oh, thank you. Awesome. Thank you so much. I will wear that with pride. Thank you. That's amazing.